Turning now to the International AIDS Conference in Vienna, the World Health Organization says there is strong evidence that male circumcision can reduce the risk of heterosexually acquired HIV infection in men by approximately 60%. VOA's Margaret Besheer met an American doctor who has invented a pioneering device to make circumcising baby boys safer and sterile.
David Tomlinson is a family physician in the U.S. state of Rhode Island. He explains how HIV, the virus that causes AIDS, can enter a man's body through his penis.
The inner mucosa of the foreskin, which is skin just on the end of the penis, has a mucosal membrane that we now know the virus is the portal of entry. So by removing that foreskin, you basically shut the door so the virus can't get into the body.
Instruments currently used to circumcise males, such as these, can be reused and, if not properly sterilized, can transmit infection to other infants. Dr. Tomlinson says in the wrong or inexperienced hands, they can also be dangerous.
If you get the tip of the penis stuck in the clamp and you make your incision, you can actually cut the top of the penis off completely.
So Dr. Tomlinson set out to make a single-use device that would protect a child no matter who was performing the circumcision.
So we really wanted to develop a device that entirely protects the child, regardless of who the provider is and where they are in the world. And so it starts with a shield that protects the tip of the penis. Once the shield is in place and the foreskin is aligned on the shield, the clamp goes on. Once it's locked in place, it's activated, and the procedure is complete. An internal blade makes the incision. The arms actually pinch the skin so it fuses it so the child doesn't bleed. When you're done, you release the clamp, and the clamp can be removed. The one advantage for Africa in particular is that all the protected or the contaminated parts are protected so they can't injure somebody else. The device is destroyed, so there's no chance this could be reused on another infant. And so we really think the device will not only protect children during the procedure, but will protect other children after the procedure by not allowing them to use the contaminated instruments.
Dr. Tomlinson says the device, called the AccuCirc, is so simple and accurate to use that even a child could correctly perform a circumcision with it. Not that he's suggesting they should, however, but he is making the point that in parts of the world lacking adequate health workers, others could be trained to perform this procedure. Dr. Tomlinson's looking to develop an adult version of the AccuCirc. His device is currently available in the United States, and he's hoping it will be available in developing countries soon. The World Health Organization cautions that while circumcised men are 2 to 3 times less likely to be infected by HIV than uncircumcised men, circumcision still only provides partial protection and should be only one element of a comprehensive HIV prevention package, which includes HIV testing and counseling services, treatment for sexually transmitted infections, and safe sex practices, particularly condom use. In Vienna, I'm Margaret Besheer.